What are the symptoms of LPR, laryngopharyngeal reflux? Imagine feeling like something is stuck in your throat or constantly needing to clear your voice. If that sounds familiar, you might be experiencing symptoms of laryngopharyngeal reflux, or LPR for short. This condition happens when stomach acid and digestive enzymes travel back up the esophagus and reach the throat and voice box area. Unlike typical acid reflux or gastroesophageal reflux disease, which often causes heartburn, LPR usually does not. That's why it's sometimes called silent reflux. The symptoms mainly affect the throat, voice, and upper airway. One of the most common signs is hoarseness or changes in how your voice sounds. You might notice your voice is weaker, less clear, or tires easily. Sometimes, the voice can sound raspy or strained, especially after talking a lot. Many people also feel a lump or tightness in their throat, often describing it as something stuck or a feeling of throat discomfort. This sensation is called globus pharyngeus. Frequent throat clearing is another typical symptom. It often happens because the throat is irritated and trying to clear itself. You might also develop a persistent dry cough, which can be worse at night or after meals. Excess mucus or phlegm in the throat is common too, and it can be hard to clear, sometimes mistaken for post-nasal drip. Some people experience a sore throat or throat pain without any signs of infection. Difficulty swallowing is another symptom, where it feels like food is sticking in your throat, but actual swallowing problems are less common. In some cases, reflux can cause choking spells or wheezing, especially if the airway gets irritated. People with LPR might also notice a sensation of post-nasal drip without typical nasal symptoms. For singers or voice professionals, symptoms can include longer warm-up times and a coating feeling on the vocal cords. While less common, more serious complications can occur if reflux is left untreated. These include vocal fold ulcers, scarring, or an increased risk of cancer in the throat or esophagus. Because symptoms of LPR often overlap with other conditions, doctors usually diagnose it through a combination of symptom review and a throat examination. Sometimes, they use a scope to look for redness, swelling, or mucus. Additional tests like pH monitoring or endoscopy might be needed to confirm the diagnosis. In the context of acid reflux and gastroesophageal reflux disease, LPR is an upper airway from where acid affects the voice box and throat rather than causing heartburn. Managing LPR often involves lifestyle changes, dietary adjustments, medications to reduce acid, and in some cases, speech therapy or surgery. Healing can take time, so patience and consistent treatment are key.